All right, Doc, this is what I call scrubbing a file. When a patient comes in for their second visit and you already did an exam on them, you don't need to have all the exam findings carry over to the second visit. So what you do is everything above chief complaint, delete that, and hit daily note. For your subjective, change the date. So let's say today was the first, they're on their second visit, which is the second. Get rid of days per week, but leave their pains and stiffness. Their etiology is how did it begin. I can get rid of everything after this. I don't need the aggravating factors, the palliative factors, their past medical history, the review of systems, their family history, who their primary care physician is. So basically the subjective second visit is going to be office notes, complaint with the date changed, where they're hurting, how it's rated, and when did it begin. For their objective finding, get rid of all of the objective findings, vitals, visual range of motion, reflexes, orthopedics. Go right to either the cervical syndrome or the Deerfield or whatever checks you use. Get rid of that. And I leave the x-ray in there so that I know I ordered x-rays. But what I do, if the patient hasn't had the x-rays taken, I eliminate this and I go to palpation or cervical syndrome. I go to the exam findings where it says radiographs and put down today's date, which I'll say is the second. The patient had x-rays taken, but they weren't taken yet. That way I don't ever forget, hey, dude, you get your x-rays taken yet? No, I haven't. I forgot. No problem. I'll change the date, and I'm going to keep reminding you every visit. That way I don't forget about it. And once the x-rays come in, I'll simply take it out like this, and then I'll put in the findings of the x-rays under records review. So I would just simply say I reviewed today's records for this patient, 1 page of records. It was on the neck. Let's say I did a neck x-ray, and then I would put down when the date was taken. Let's say it was taken on that date, and then again what the findings were, normal or whatever the findings were. From there, for your assessment, leave in your diagnosis, leave in your status, leave in your prognosis. Get rid of your functional outcome assessments, whether it be the AMA or the oswestry or the neck index or the pain index. We'll get rid of those. And for your plan, you don't need for this daily note how many times you're coming in a week, when their re-exam is, why you're doing therapy. Just keep the treatment notes of what was physically done that day. So I'll take out, there was an exam, for example. And then I'll leave in where I did the therapy, where I did the adjustments. I'm going to get rid of everything after return visit. Get rid of our goals, get rid of their exercises, their stretches, and any other recommendations you have for them. So now when we look at it for a daily note, we have etiology, where their pain is, what we found on that day as far as palpation findings, where their muscle spasms were, what their diagnosis is. I can also put down on their second visit progress. The patient is progressing as expected or mildly improved. So we can update our progress during the assessments. And then our plan, again, patient come back in a week, doing better. So that's how you would scrub an exam from one visit, on the initial visit, to the second visit. And it's easier to do this on the all-in-one provider versus the iPad. Everything else I do on the iPad, but for the most part, this is easier to do on the PC or your desktop. All right, thank you very much.